Hello, my name is Dr. Stacy Grundy, and I'm the Executive Director of Health Equity. I was born and raised in rural Southern Illinois, and I come to IU from Southern Illinois University School of Medicine, where I was a research assistant professor in our Population Science and Policy Department. I've been doing health equity work kind of before the term health equity was coined. I attended the University of Illinois at Urbana-Champaign, and I really started volunteering. And so Illinois Department of Public Health, they had a program called BASUA, which was Brothers and Sisters Uniting Against HIV and AIDS. And so I had the opportunity to go to a support group for young African American women who, a lot of them were my age. I didn't see statistics when I went in that group. I saw people who looked like me, my friends, my cousins. And so it really, I think at that moment, I really figured out that this is what I'm supposed to do. I feel like it's my ministry. I feel like public health is more than just a job. There's actually a depiction of health equity where you have individuals who are at different heights and they're looking over a fence. And you have one person who is taller and they can look over the fence. You have someone who is, smaller and shorter. And so with health equity in that box is that you might give the person who is shorter more boxes to look over the fence. But in a perfect world is when there is no fence. And so removing those barriers, if there were no barriers, based on race, based on sexual orientation, based on, residence, location, zip code, that type of thing, then we wouldn't need health equity. But because those barriers exist, then health equity is definitely needed. We know that marginalized populations are more at risk for certain things. It could be LGBT, it could be rural residential status, it could be race. And so looking at the data, that really helps us really identify those populations so that we can create interventions. The goal of the entire Department of Health Equity is really just to embed health equity into every system at IU Health, where it's something that we don't even have to think about. That is just integrated, that whenever we're creating any process or we're doing any changes in Cerner or any changes in registration, that health equity is at the forefront.